So in section 2, we're gonna talk about who gonna use health services. But first of all, we're gonna talk about interpretation of symptoms. So whenever we do have a symptom, there are gonna be like different factors that can help us to just interpret those symptoms. First of all, it's gonna be prior experience. For example, if you would have some sort of common disorders, for example, if you would get cold or you would have like flu, you know about the symptoms and you're gonna actually interpret them based on your prior experience. Yet, if you would have a sudden pain in your heart, you would be concerned, right? You would go to the doctor because you would just say that, oh, I'm just 20. Why I do have like a very just bad pain in my chest. So probably it's going to be something very important that I have to address. So it's going to impact the way you're going to interpret your symptoms. Another way going to be expectation. For example, before your period, you do have some expectations about a specific symptom. Some people they do have headaches. Some other people they do have like swollen body or a specific feeling in their breast. So they do expect these symptoms to come. But if you wouldn't be close to your period, you wouldn't expect that. So if this happened to you, if you would have like a swollen body or like something like that, you would be concerned. You would just say that, oh, okay, there is no reason to feel like that. So it might be something important. Another one gonna be seriousness of the symptoms. Okay, if you would have a pain in your toenail, I mean, you would be really sad because it is very painful whenever you are just wearing shoes and all that, but you wouldn't be very concerned compared to when you would have like a crazy pain in your chest or in your heart. If you would have like a bad pain in your heart, you would just definitely go to the doctor. You would just schedule a meeting, an appointment actually. But like a toenail gonna be like more flexible. You would just postpone that. You would just say that, oh, it's gonna be okay, probably. I don't know, my shoes, they were not the most comfortable ones, so this happened. So seriousness of the symptoms, they are very important, and the part of body that you're gonna experience the pain gonna impact the way you're gonna interpret your symptoms. So, there is actually a model here, common sense model of illness. It is very important. It is like different from one individual to another one. And it is like a framework that everybody gonna interpret and follow specific rules to interpret their symptoms. And the way they're gonna represent their illness, it's gonna be based on that common sense model. I'm gonna talk more about this. So this common sense model has like different criteria, but depending on the identity of your illness, you're going to interpret and just try to just understand that illness based on your common sense model. For example, identity going to be name of the illness. Okay, if for example it's flu, you know about the consequences of flu, you know about the symptoms, so you're going to interpret that based on your common sense model. Causes, for example, for flu, you know that probably someone was infected, you just hung out with them, and probably you got the bug from them. Consequences, you already aware about the consequences of flu and you know what to do. And here is common sense model. Some people like me, they would go to the doctor like directly, even though they would just have a flu because I know about my body. I know my immune system is not the best, so I have to address that. Otherwise, this flu gonna be in my body for like 2 months. But I do have some friends and family member, like my dad. He would never ever go to the doctor because he feel like it's gonna like the flu gonna get out of his system. So his common sense model gonna be different from me, even though we do have some sort of common shared genetic basis, but still we are very different because of the environment, because of our personal beliefs. So you can see that even in one family, the common sense model might be different. But in general, try to understand common sense model and just know that it is a psychological framework. Another point that is very important about common sense model going to be timeline, which going to be length of time that the illness going to be expected. For example, in my case, like I said, if I wouldn't go to the doctor, I would have the flu for like almost forever. But some people, I mean, they're going to be okay after 2 days. Control or cure, it's going to be the idea that whether you can just manage that illness or you cannot. If you cannot manage that, you have to go to doctor. Another one gonna be coherence, which is basically how well this belief gonna represent the disorder. It is like gonna be like the whole idea of common sense framework, like the way you're gonna actually interpret, let's say, timeline, control or cure, consequences, identity, and all of that. They're gonna actually show up in coherence as well. Okay, this part is very important. Definitely, there's going to be at least one question in your quiz. It is about different models for illness. The first one going to be acute illness. It's going to be a belief that that illness is acute and it's going to be caused by viral or bacterial agents. It's going to be very short in duration. It's not going to have any long-term consequences. Whenever you're going to get flu, it is bad, I know, but it's going to be short. It's going to get out of your system very soon. Chronic illness, we don't like that. They are taking forever, and they're going to be caused by multiple factors. Like I said, they're going to be long in duration and they're going to have severe consequences. We talked a lot about this in chapter 4, chapter 5, chapter 6. For example, diabetes, cancer, they're all going to be chronic illness. Cyclic illness is very common nowadays. Sorry about my voice. It's just very common nowadays, but it is like a period of having illness. For example, if you have migraine, you know that, for example, you are good for a week, but suddenly migraine gonna hit, you're gonna be very sick for like 2 days, you cannot work at all, but you're gonna be okay after that. Another way gonna be whenever you have like some sort of excessive headache, you're gonna be okay for 10 months, but again, it's gonna just attack you and it's gonna make you disabled for like 2 months. But it's a period, it's a cycle, it's not forever and it's not short term. It's gonna come and go, if that makes sense. Um, oh, this idea is very important too. Lay referral network is like basically your mom and dad or your family member or your friends, and it's gonna be that moments that you're gonna text people like your friends or your family, and you just gonna tell them that, hey, I do have headache, I don't know what to do, and your mom probably gonna tell you, hey, just have some chamomile tea, you're gonna be okay. This gonna be referral network. Um, but there are some moms out there, they would just literally ask their children, oh, you have to just visit doctors. It's very serious, baby. I mean, it's just different from family to family, and that's why it is referral network. But like that kind of connection, they can help you to just interpret the symptoms. They're gonna give you advice, and they're gonna give you various home remedies like chamomile tea and all that. Another way of interpreting symptoms, it's gonna be internet. We are just very familiar with that. I Google every symptoms all the time. Especially back in COVID, all I was doing instead of just doing my PhD, it was just Googling different symptoms that I had and just make them, let's say, relevant to COVID to just make sure if I got COVID or not. Like literally, if I would go to grocery shop, after going back home, I would just Google like even like coughing to just see, oh, okay, maybe I got COVID when I was in Trader Joe's or like something like that. But it seems like almost 75% of internet users, they find health information from internet. Many physicians, they also do the same. And I'm telling you, my cousin, she is a fellow, like not a resident. She finished her residency. She is now a fellow, but still, I can see her whenever she has a patient. After the visit, she would just Google some stuff to just see if she was correct or not. And I guess majority of doctors, they would do that because your memory can do only a little. You cannot memorize all the symptoms. It can be good, the internet, but it can be very bad too because there are like a lot of misinformation out there. For example, they might say your illness is just very serious, yet it's not. Or they might just say that, oh, it's just gonna go away, but it wouldn't, and it might be a serious problem. The best way is just using internet, but in a good way. For example, after you can see the symptoms they're gonna just say in your body, you should definitely go to your provider and ask for help. Here is just the good and the bad that I already mentioned. It's just good because it can just help you sometimes, but it might be bad too.